हेलो स्टूडेंट्स। आज हम रिकॉल करेंगे FMT PYQ INICET 2024। फर्स्ट क्वेश्चन है, ए 40 year old female consumed a white colored rodenticide powder and present with a potassium level of 2.5 millicule per liter. On examination she has an irregular pulse and muscles paralysis. ECG shows multiple ventricular ectopics. What is the suspected poison? A aluminium phosphide, C zinc, ऑप्शन थोड़े ऊपर नीचे हो गए। बी वॉर्फरिन टॉक्सिसिटी, सी जिंक फॉस्फाइड, डी बेरियम कार्बोनेट। इसका करेक्ट आंसर है डी, बेरियम कार्बोनेट। Barium carbonate is a rodenticide which presents with classical features of areflexia and paralysis. Other symptoms include tingling sensation, tremors, cramps, stiffness of the muscles, paralysis of the tongue and larynx, myoclonus, myalgia, flaccid quadriplegia, hypertension, arrhythmia, ectopic beats, ventricular fibrillation, irregular pulse, shock, cardiac arrest, pulmonary edema, mydriasis, vertigo, headache, confusion, convulsions. Postmortem findings not specific. Submucosal hemorrhages may be seen in the GIT. Second question. During autopsy of fetal death case, what is the order of examination to differentiate between live birth and stillbirth? A. Abdomen, head, thorax. B. Thorax, head, abdomen. C. Head, abdomen, thorax. B. Head, thorax, abdomen. इसका आंसर है D. Head, thorax and then abdomen. During the autopsy of a fetal death case, the order of internal examination is critical for determining whether the fetus was stillborn or live-born. The standard and most logical approach is head, thorax and abdomen. Question number 3. A patient presents with paresthesia, tetany, muscle twitching and muscle cramps, along with urinary crystals as shown in the image. These symptoms are typical of poisoning with what substances? A. Cysteine, B. Xanthine, C. Ammonium urate, D. Calcium oxalate. इसका आंसर है D. Calcium oxalate. The above scenario is diagnostic of oxalic acid poisoning. Sign and symptoms: fulminant poisoning, burning, sore or bitter taste in the mouth with the signs of constriction around the throat and burning pain from the mouth to stomach, radiating all over the abdomen. Nausea and irritation are immediately followed by vomiting which contains altered blood mucus, acute poisoning, tingling and numbness of fingers and limbs, weakness, paresthesia, uh, carpopedal spasm, hyperirritability of peripheral nerves, Shobstruck sign or wheeze sign, tetany, convulsions, coma and death. Delayed poisoning characterized by nephritis, uremia, scanty urine, hematuria, albuminuria, oxaluria. Envelope-shaped calcium oxalate crystals. Question number 4. Declaration of OSCO by World Medical Association in 1970 deals with A. Therapeutic abortion, B. Torture, degradation of or cruel treatment of prisoners, C. Ethical aspects of medical researches, D. Hunger. इसका आंसर है A. Therapeutic abortion. The Declaration of Oslo discusses the role of doctors in therapeutic abortion. It was developed by the 24th World Medical Assembly, Oslo, Norway, August 1917 and amended by 35th World Medical Assembly, Venice, Italy. Question number 5. Match the following sexual paraphilias. A. Eonism, B. Necrophilia, C. Frotteurism, D. Exhibitionism. इसके 1 2 3 4 इसके आंसर्स हैं मैच करने वाले। इसमें है इसका आंसर ए को हम 4 से कनेक्ट कर देंगे, बी को हम 3 से कर देंगे, सी को 1 से कर देंगे और डी को सेकंड से कर देंगे। Eonism, sexual pleasure by wearing clothes of the opposite sex. Necrophilia, sexual gratification by intercourse with dead body. Frotteurism, sexual gratification by rubbing private parts against another person, exhibitionism, exposure of one's genitals to an unsuspecting stranger. Question number 6. Which of the following substances are antidotes for cyanide poisoning? A. Amyl nitrate, B. Sodium nitrate, C. Sodium thiosulfate, 4. Benzyl thiocyanate. इसका आंसर है ए 1, 2 एंड 3 ओनली. ये तीन इसका आंसर है एमाइल नाइट्रेट, सोडियम नाइट्रेट एंड सोडियम थायोसल्फेट. Question number 7. Identify the source of the trauma given in the image below. A. Bullet, B. Rod, C. Axe, D. Scissor. इसका आंसर है A. Bullet. The above image is of bullet wound showing the beveling of the skull, entry wound, clean wound, exit wound, cone-shaped erosion. Beveling is always seen at the exit point of the table. In the entry wound, beveling is towards the inner table. In the exit wound, beveling is towards the outer table. Question number 8. Which among of the following is not seen in heat exhaustion? A. Loss of thermoregulatory mechanism. B. Altered sensorium. C. Orthostatic hypotension. D. Core body temperature below 105 Fahrenheit. इसका आंसर है A. Loss of thermoregulatory mechanism. Loss of thermoregulatory control is a hallmark of heat stroke, not heat exhaustion. In heat exhaustion, the thermoregulatory mechanisms are intact but overwhelmed. Question number 9. Which of the following pairs of antidotes and toxicities is correctly matched? A. Organophosphorus, physostigmine, B. Atropine, L-carnitine, C. Benzodiazepine, flumazenil, D. Arsenic, desferrioxamine. इसका आंसर है सी बेंजोडाइजेपिन फ्लूमाजेनिल. Flumazenil is a specific benzodiazepine receptor antagonist and is used to reverse benzodiazepine-induced sedation or overdose. Question number 10. A student present with shock, pulmonary edema, and a positive silver nitrate breath test after consuming an unknown substance. What is the antidote? A. BAL, B. Pralidoxim, C. MgSO4, D. Atropine. इसका आंसर है MgSO4. The silver nitrate breath test detects phosphine gas, confirming aluminum phosphide poisoning. Aluminum phosphide poisoning releases phosphine gas, which causes severe mitochondrial dysfunction, circulatory collapse, and pulmonary edema. Magnesium sulfate stabilizes myocardial membranes and helps counteract hypomagnesemia, a common complication. Management includes supportive care, fluids, vasopressors, oxygen therapy, magnesium sulfate, and antioxidants. Question number 11. The compound shown in the image can be used in the treatment of which of the following poisoning? A. Ammonium phosphide, B. Mercury, C. Phosphorus, D. Arsenic. इसका आंसर है C. Phosphorus. Copper sulfate acts as an oxidizing agent and converts elemental phosphorus into less toxic compound. It is specifically used in phosphorus poisoning cases. Question number 12. Marshall's triad, punctate, laceration, bruises, and abrasion is seen in which type of blast injury? A. Primary blast injury, B. Secondary blast injury, C. Tertiary blast injury, D. Quaternary blast injury. इसका आंसर है B. Secondary blast injury. Secondary blast injuries are caused by flying debris and shrapnel propelled by the blast. This results in Marshall's triad, punctate, laceration, bruises, and abrasions. Characteristics of injuries from high-velocity fragments. Blast injuries are common physical traumas resulting from direct or indirect exposure to an explosion, leading to sudden changes in atmospheric pressure. ये था 2024 का INICET recall. Thank you so much guys. If you like this video, please share and subscribe my channel.